Hello and welcome to Health Professional Radio. My name is Patrick Reyes, and on today's show we have Dr. Glen Maberly. He is a senior staff specialist endocrinologist at Blacktown at Mount Druitt Hospitals. A program lead. Currently, he is the driving force behind the Western Sydney Diabetes, or WSD, initiative. Welcome to the show, Glen.
Thank you.
All right, now can you give us a little bit more background on who you are and what it is you do?
So, Western Sydney Local Health District is located around Parramatta, Blacktown, two major centres, and the surrounding suburbs. We look after a population of about 1 million people. Our population is very culturally diverse, and we are in a diabetes hotspot. What I mean by that is that if you're living in our patch, compared to the seaside suburbs, or maybe the northern suburbs of Sydney, you have twice the chance of having diabetes. So our local health district, along with the primary health network funded by the Commonwealth, have come together to form an alliance around addressing and beating diabetes in our area.
And now, one of our topics for today is FITTER, or Forum for Injection Technique and Therapy Expert Recommendations. Can you tell us what that's about?
Okay, so about a year or so ago, I was invited with three other people in Australia, a GP and a nurse practitioner, to attend an international conference in Rome, which was organized as FITTER. FITTER stands for Forum for Injection Technique and Therapy Expert Recommendations. I'd rather say FITTER than that. And it actually connected with, through different means, different ways of communication, 32 countries. And this was I think the third meeting of FITTER, coming up with recommendations on injection techniques and infusion techniques around diabetes. You would think that that was a pretty dull subject, and I thought it was a little bit. Being an endocrinologist, usually I left that kind of discussion to my diabetes educator to work out with the patient. But I was really found out that the injection technique is really very important, ensuring that you can have patients get good control of their diabetes.
And how does that research prevent progression of diabetes?
Well, it was a consensus meeting from input from people all around the world. As I said, a second meeting. And it actually came out through presentations of the data from the literature, plus working groups, to over 20 different recommendations. So the main thing that I learned through that process is that remembering the normal anatomy of the skin and the subcutaneous and muscle tissue is that where you are wanting to inject insulin and other injectables to help manage diabetes is into the subcutaneous tissue. And the skin is only a couple of millimeters thick, and if you get beyond 6 millimeters, you are often going into muscle. Mm-hmm. So if you are injecting into muscle, then the absorption of insulin and the whole dynamics changes. So it's really important to use good injection technique. And essentially one of the key messages is that these days very thin needles, 4 millimeters in length, are preferred. And in kids and in very thin people, you actually have to lift up the skin fold, pinch together the skin fold, so you don't actually penetrate into muscle. So that's the key, I think, basis for a lot of the recommendations. Some of the other recommendations relate to the fact that if you inject insulin and other insulin-like solutions into the space, you get a lot of fat and skin disorder, so you get bumpiness. It's called the lipid dystrophy. If you inject into those areas, the absorption of what you put in there is very variable, can vary up to 30 to 50% of the effective dose. So one day you're injecting into normal area, the next day you inject into the lump, and the variation in dose you're getting can be 30 to 50% different, and explain why blood sugars are not well controlled. I guess so. In trying to avoid that, you have to feel the skin, identify where these lumps are, look at, inspect it, and feel it, and avoid them. And with a small needle, you can actually inject into a much wider area than a lot of people usually think about. So you've got the whole of the abdomen. You can inject into other sites like the buttocks and the legs and the arms, but that's probably not really that preferable, and you're much more likely to have to get into the muscle tissue if you do that. So injection technique can be really very important, and there are, as I mentioned, about 15 other recommendations or tricks associated with getting this right.
Now, how does FITR benefit those with diabetes?
Well, FITR is just this organization which was sponsored by a company called BD, but the people came together as independent scientists. They came and made these observations and looked at the literature, and the outcome of that meeting in Rome and all this work has been published in a peer-reviewed journal in the Mayo Clinical Proceedings in September 2000. So FITR is really a coalition, and it has some coalition of members in various countries. In Australia, we don't have a particular FITR group, but a few of us went to the FITR conference.
Now, what's the biggest misconception that comes with your line of work?
Well, in the past, we've tended to think that you tend to use longer needles in people that may be overweight or obese. So the bigger the person, the bigger the needle. In fact, the skin thickness is just the same, and so you don't have to use larger needles in bigger people, and that everyone, including kids and adults, these days probably do much better with a smaller needle. The second thing is that you should only use the needle once. People try and save money. The government in Australia covers that cost anyway, but a blunter needle tends to cause these lumps, and injecting into lumps continues to make them grow bigger, so you need to avoid them. You need to clean the skin, but you don't have to disinfect the skin unless there is a infection problem, and it's important then when you bring your insulin out, let it warm up to room temperature, because cold insulin from the fridge is more painful. And injections into the abdomen with these very fine needles usually do not cause pain. Occasionally it can cause pain if you hit a nerve, but it's a minor irritation. And putting insulin into the abdomen is less painful than pricking your finger to find out what the blood sugar is. A lot of patients with diabetes are scared of the needle and scared of getting going, and I think once they get going with the needle, it's going to be near the end of life almost. That's not true. It is actually a preventative way of controlling blood sugar and should be introduced earlier and when needed.
All right, and now before we end our segment, how can our audience reach out to you or learn more about FITR?
I think that there is a FITR website now that has the publication. So just the good old Dr. Google will get you, FITTER, will get you information. And if you want to know more about what we're doing in Western Sydney, we're working in primary prevention of diabetes, more screening to identify people that don't know they have diabetes. About half the people with diabetes don't know that they have it, and they can measure it with a simple test. Or the management of diabetes, you can also use Dr. Google to look up Western Sydney diabetes.
All right, well, thank you for joining us today, Glenn.
Okay.
Now, you've been listening to Health Professional Radio. I'm your host, Patrick Reyes, and we've been in conversation with Dr. Glen Maberly as we talked about diabetes and FITTER, which is a forum for injection technique and therapy expert recommendations. Now, if you've missed our conversation or if you'd like to listen to this interview again, transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.